Bismillahirrahmanirrahim. Today we talk about the gastric cancers and particularly the gastric adenocarcinoma. The gastric adenocarcinoma, which is the most common malignancy that occurs in the stomach, arises from the columnar glandular epithelium. The second tumor, known as the lymphoma, which arises from the lymphoid tissue, particularly the mucosa associated lymphoid tissue that happens in the mucosal layer of the stomach, and therefore it is also known as the malt lymphoma. Carcinoid tumors, they arise from the enterochromaffin or neuroendocrine cells located in the gastric pits of the stomach, may be benign or malignant, and may give rise to the carcinoid syndrome. The gastrointestinal stromal tumors are found in the stomach and intestine, and they may be benign or malignant. The GIST or gastrointestinal stromal tumors arise from the specialized cells which are known as the interstitial cells of the Kajal. These cells are located in the muscular layers of the gastrointestinal tract, and they act as a communication between the autonomic nervous system and smooth muscles. The fifth and rare tumor is the leiomyosarcoma, which arises from the smooth muscles located in the gastric wall. The gastric adenoma, which is a malignant tumor of the gastric glandular epithelium, is the most common malignant tumor in the stomach. 90% of all gastric cancers, they are gastric adenocarcinoma. The early symptoms of the adenocarcinoma resemble those of the chronic gastritis. By that we mean that there are vague signs and symptoms. Mostly these symptoms include dyspepsia and nausea. The specific clinical manifestations of the adenocarcinoma, for example, weight loss, anorexia, altered bowel habits, anemia, and hemorrhage or bleeding, these symptoms appear very late in the disease. And at this time, mostly it is too late, the patient seeks medical advice. And this delay in the appearance of the specific symptoms causes delay in diagnosis and the treatment difficulties. Because if the tumor is limited to the mucosa and submucosa, it can be surgically resected with most hopes. But if the tumor spreads and gets metastasized, then the role of surgery becomes limited and the treatment options are not so much successful. Gastric adenocarcinoma, geographically, it is more common in some countries. For example, it is more common in Japan. The gastric adenocarcinoma is most commonly associated with conditions that cause mucosal atrophy and intestinal metaplasia. Peptic ulcer disease itself doesn't impart increased risk for the gastric cancer, but mostly when as a treatment of the peptic ulcer, when a part of the stomach known as the partial removal of the stomach is done, then the adenocarcinoma may arise in the residual gastric stump, because uh, hypochlorhydria, bile reflux, and chronic gastritis occurs more commonly in those sites. Conclusively, the gastric adenocarcinoma is caused by an interplay of familial predisposition, genetic mutations, and certain environmental factors. It is also associated to some dietary factors, and in some areas where high salted diet and smoked foods are used, they have an increased frequency of the gastric adenocarcinoma. The gastroesophageal reflux disease or GERD, and sometimes the Barrett esophagus, which is associated to it, they increase the risk of uh, gastric adenocarcinoma, particularly the cancer when it occurs near the cardia of the stomach, where the esophagus enters into the stomach. The Lauren classification of gastric adenocarcinoma, which is based on the manifestations and histological appearance of the tumor, is that the adenocarcinoma is divided into two distinct patterns. The most common pattern is known as the intestinal type of adenocarcinoma, and it occurs in the metaplastic intestinal mucosa that occurs in the stomach, and histologically it is a well differentiated metaplastic intestinal uh, epithelium under the microscope. The second type of tumor, which is more aggressive in its behavior, is the diffuse type of gastric adenocarcinoma. And as compared to the intestinal type of adenocarcinoma, this tumor is very poorly differentiated, or we can say that it is undifferentiated. Now, the intestinal type of gastric adenocarcinoma, two factors are very important. The one well studied component is the infection with the gram-negative bacillus Helicobacter pylori. We know that H. pylori causes infection in the gastric mucosa, and this is associated with inflammation. Over time, the repeated cycles of inflammation and repair, we know that chronic inflammation has the component of scarring or repair. So by here in the H. pylori infection, the toxins that produced by the Helicobacter pylori bacteria, they enter into the epithelial cells and cause extensive damage to these cells. So epithelial cells are continually lost and are replaced by the newly regenerating epithelial cells. As we know that the epithelial lining of the gastric mucosa, it consists of labile cells that proliferate throughout life. The old cells are lost and new cells are they are replaced by the newly generating cells from the pre-existing mature epithelial cells and sometimes from the stem cells. So in chronic H. pylori gastritis, what happens that by destroying a large number of epithelial cells, the gastritis is turned into atrophic gastritis. And this repeated cycles of inflammation and repair and repeated divisions of the gastric epithelial cells, they undergo intestinal metaplasia. We know that persistent irritation to the epithelium will cause the cells to undergo metaplasia. So here in H. pylori infection, which continually and persistently irritate the gastric epithelium, it causes the epithelial cells to undergo intestinal metaplasia. And we know that metaplasia is a condition in which one adult type of epithelium is replaced by another adult type. And in this situation here occurs the intestinal metaplasia. The gastric epithelium is replaced by the intestinal epithelium with the absorptive tall columnar cells and also the presence of the goblet cells that are not usually present in the stomach and are present in the intestine. Now the metaplastic tissue carries increased risk to become dysplastic, in which there is loss of structural and functional orientation, and the cells they lose similarity to the original cells from where they are derived. Dysplasia, as we know, is maybe mild, moderate, or it may be severe dysplasia when there is complete loss of structural and functional orientation. So what happens that over time mutations accumulate and the dysplastic cells are converted into new plastic cells or cancerous cells. So here this game is played by the accumulating genetic mutations, particularly those genes that are involved in the cell cycle. Here we specially talk about the tumor suppressor genes, of which p53 gene is well known, and the proto-oncogenes. The tumor suppressor genes normally they act as a brake for the cell division, for the mitotic cell divisions in the cell cycle. And here when they are well and not mutated, they will not allow those cells having defect in their DNA when the DNA is their DNAs are damaged, and also cells with mutations. They are not allowed to proliferate, and they are rendered to either DNA repairing or the apoptic cell death. On the other hand, the proto-oncogenes, which act as accelerating pedal, they promote cellular divisions, but when they become mutated, they are known as the oncogenes. And by mutations that occur in the tumor suppressor gene and proto-oncogenes that are involved in the cell cycle results in the continued proliferation and division of the mutated cells, and these mutated cells are neoplastic cells, and the result is the intestinal type of gastric adenocarcinoma. The second less studied component that function in the pathogenesis of the intestinal type of gastric adenocarcinoma are the mutations that occur in Adenomatous polyposis coli genes. Adenomatous polyposis coli syndrome is a syndrome that commonly occurs in the large intestine, and it is characterized by the presence of a large number of polyps, and it has got association with the causing increased risk of colonic cancer, but also they have a role in the by increasing the risk in the stomach of the intestinal type of gastric adenocarcinoma. So the two important components in the pathogenesis of intestinal type of adenocarcinoma are the H. pylori infection and the mutations in the Adenomatous polyposis coli gene. Morphologically, the intestinal type of gastric adenocarcinoma is a well-differentiated tumor. Unlike the diffuse type of adenocarcinoma, which is undifferentiated. So, on gross appearance, the intestinal type of gastric adenocarcinoma may appear either an exopitic mass that project into the lumen of the stomach, or it may become ulcerated and form large ulcers. And they appear as irregular large ulcers with heaped edges, as is clear from this picture. These are the heaped edges and this is the ulcer. As I said that comparatively it is a well differentiated tumor, so under the microscope we may see tumor composed of the glandular structures, and this type of appearance is also seen in colonic adenocarcinoma and esophageal adenocarcinoma, in which also there occurs the intestinal type of metaplasia. But compared to the diffuse type of adenocarcinoma, the tumor cells are strongly adherent to each other. In the diffuse type of adenocarcinoma, the adhesions among the tumor cells, they are loose and the cells are detached from each other. But in intestinal type of gastric adenocarcinoma, the tumor cells are closely adherent to each other. Now coming to the pathogenesis of the diffuse type of adenocarcinoma, which is comparatively an aggressive tumor, and as we say diffuse, it forms and diffuses through the gastric wall, and in the pathogenesis of diffuse type of adenocarcinoma, two factors or two components are very important. The CDH-1 gene, which is a tumor suppressor gene, and this gene is responsible for the formation of a protein known as the E-cadherin. It is a membrane adhesion molecule and the cells are stick to each other. Moreover, this E-cadherin molecule transmits signals through the cells that help in the controlling the cell cycle and cellular divisions. But in diffuse type of adenocarcinoma, what happens that this CDH1 gene, which is a tumor suppressor gene, it becomes mutated. So when it becomes mutated, what happens that the cells then are no so closely stick together, but they detach from each other due to the defective E-cadherin protein, which is encoded by the CDH1 gene. So the mutation in the CDH1 gene causes the epithelial cells to detach from each other, and these cells, when becomes neoplastic, they start uncontrolled proliferation and are turned into the neoplastic cells, malignant cells. The second component that work or function in the pathogenesis of diffuse type of adenocarcinoma is the Epstein-Barr virus. The Epstein-Barr virus is also the cause of well-known cause of infectious mononucleosis and is associated with Burkitt lymphoma, but in causing the diffuse type of adenocarcinoma in the stomach, the mechanisms by which the EBV or Epstein-Barr virus play a role are not well studied. So we can say that by unknown mechanisms, the Epstein-Barr virus infections put the person at increased risk of gastric adenocarcinoma. Now, the gastric adenocarcinoma of the diffuse type is it causes diffuse infiltrations in the wall of the stomach. What happens that the normal rugae that are present in the stomach, they are lost. Particularly the submucosa of the gastric lining, it becomes thickened and it becomes hard and more rigid, and more or less the stomach is converted into a leather bottle. This is known as the gastric laminitis or laminitis plastica. Here in this gross picture, we can see that the gastric wall is thickened and the rugal folds are partially lost. Histologically, what happens that the vacuolated cytoplasm, which contain large mucin vacuoles, they displace the nucleus to the periphery of the cell and give rise to the formation of the signet ring shapes. The large giant cytoplasmic vacuoles push the nucleus to the periphery, giving it the appearance of the signet ring shape. So the laminitis plastica or gastric laminitis and the microscopically signet ring appearance are particular characteristics of the diffuse type of gastric adenocarcinoma. So here we summarize the pathogenesis. So in intestinal type of gastric cancer, the commonly involved components are the chronic gastritis and chronic mucosal atrophy, which is caused by the Helicobacter pylori bacterium induced chronic gastritis. And the second component in the intestinal type of adenocarcinoma are mutations in Adenomatous polyposis coli genes. When we come to the diffuse type of gastric adenocarcinoma, so infections, mutations in the CDH-1 gene, which is responsible for the formation of cadherin protein, which causes the epithelial cell to stick together, and the protein also play a role in the transmission of the signals that control the cell cycle. So when the CDH1 genes becomes mutated, the E-cadherin, defective E-cadherin is formed, and the cells are no more, they do not remain stick to each other and are separated from each other and start uncontrolled division. The EBV or the Epstein-Barr virus, which is commonly responsible for the disease known as the infectious mononucleosis and are also associated with the Burkitt lymphoma. It has also got role in the pathogenesis of the diffuse type of gastric adenocarcinoma, but the mechanism is not well understood. In this slide, we can see intestinal type of adenocarcinoma, where this is an ulcer with heaped up borders and central zone of the ulceration. This is the diffuse type of gastric adenocarcinoma, in which the stomach is converted into a leather bottle known as the lentis plastica, and the gastric walls are thickened and the rugal folds are partially lost. Under the microscope, we can see the signet ring cells in which the large vacuolated cytoplasm push the nucleus towards the periphery, and this is a characteristic of the diffuse type of gastric adenocarcinoma. The risk factors for the gastric cancer commonly includes the family history, H. pylori infection, particularly for intestinal type of gastric adenocarcinoma, the Adenomatous polyposis coli syndrome, and the Epstein-Barr virus infection, which is involved in the diffuse type of gastric adenocarcinoma, and presence of adenomatous gastric polyps, particularly if they are of large size, more than 2 centimeters, they carry risk of intestinal type of gastric adenocarcinoma. smoking, being male and aged, and the chronic atrophic gastritis or uh, chronic autoimmune gastritis, which causes loss of the parietal cells that produce intrinsic factor and the hydrochloric acid. So what happens that the loss of hydrochloric acid leads to the achlorhydria, and loss of intrinsic factor cause pernicious anemia, and this imports high risk for the gastric adenocarcinoma. And people with type A blood group are also at risk of further development of the intestinal type of gastric adenocarcinoma. The sign symptoms in gastric adenocarcinoma, initially mostly the patient is asymptomatic, and this late appearance of the sign and symptoms is associated with delayed diagnosis and very less successful treatment in patients with advanced gastric cancer. And for this reason, in some areas and in some countries of the world, particularly in Japan and some other European countries, screening programs are introduced. And they take endoscopic biopsy from the individuals. And this gives an early detection of the gastric adenocarcinoma when the tumor is in the mucosa or submucosa, and surgical resection of the tumor carries high chance of success. But unfortunately, in most countries of the world, these screening programs are not properly operated. So the initial symptoms or vague symptoms are sometimes the patient may complain of no symptoms and is asymptomatic. But as the disease progresses, the epigastric pain, nausea, vomiting, weight loss, sometimes hematemesis, melena, and associated with bleeding from an ulcerated lesion in the tumor may become very prominent. And therefore, sometimes particularly the ulcerated lesions in the tumor can bleed so heavy that we may need blood transfusion. The presence of blood in the stomach can give rise to hematemesis, in which fresh blood is vomited, and this blood may be sometimes darker color like coffee ground, because the red blood cells that are present in the blood, they are digested and broken down by the HCl, hydrochloric acid, present in the stomach. And the passage of blood in the stool may cause the condition known as melena, presence of black tarry stools due to the presence of blood. And in gastric adenocarcinoma may give rise to the paraneoplastic syndromes. By that we mean that effects may occur in other organs, and sometimes the patient may appear with the symptoms that are associated with paraneoplastic syndromes. Diagnosis of gastric cancer is made by endoscopy, through which we introduce an endoscope and directly visualize the tumor, and then we take a biopsy, and the diagnosis is confirmed by histopathology. Other investigations like barium contrast X-rays of the upper gastrointestinal tract are done in patients to identify various complications and obstructions and ulcers, and sometimes we do computer tomography of the abdomen and pelvis to evaluate if the cancer has spread to nearby organs or lymph nodes, and this CT computer tomography is used for staging the tumor. but the confirmed diagnosis will be the histopathological examination of the biopsy specimen, which is taken during endoscopy. Treatment of the adenocarcinoma of the stomach, it is successful comparatively in the early stages, uh, particularly if the tumor is limited to the mucosa and submucosa. It can be removed along with uh, a part of the stomach by doing uh, partial gastrectomies, and then we can uh, increase the survival time. But if the tumor is in an advanced stage, by that we mean that if the tumor has spread to the surrounding lymph nodes or to the other organs, then we can do surgery just to give some sort of relief to the patient, and we will do this as palliative treatment or palliative surgery. Chemotherapy and radiations after surgery are usually performed to kill the cancer cells and to increase the chances of survival. But unfortunately, the overall survival rate in gastric adenocarcinoma is low. Particularly the diffuse type of adenocarcinoma is very aggressive, and it diffuses in the wall of the gastric cancer, and unfortunately the gastric tumors, the adenocarcinoma, they are usually diagnosed at later stages with little hopes and less successful treatment. Thank you very much.